I'm Dr. John McDougall. Now, people pretty much understand that extra protein is really harmful for the human body. The extra protein results in damage to the bones, liver, and kidneys. But they're sold a high protein diet, particularly as you get older, because of a condition of muscle wasting. It's called sarcopenia. And it's particularly aimed at elderly, but people who are sick, are bedridden, et cetera, they develop some loss of muscle mass also. But as a general recommendation, it's told to the general public that elderly population, that you need to eat more protein or take protein supplements. Well, don't forget the harmful effects of too much protein. And besides that, when you eat high protein foods, you're eating foods that cause breast cancer, colon cancer, prostate cancer, et cetera. You're eating the meats and the eggs and the dairy. When you're taking the supplements, you're taking in isolated, concentrated protein, which is very harmful to the bones, the kidneys, and the liver. So don't forget that part. So I'm asked quite often, well, okay, doc, you told me all these things about the harmful effects of protein. You told me that there's no such thing as dietary protein deficiency, so nobody's ever going to get a protein deficiency from any natural diet. You already told me that. But how about us older people? As we're getting older, we lose a little muscle mass. Well, as you get older, you do trim down. You do lose a little muscle mass. It's natural and normal to occur. Now, when I was first asked this question, I went to the scientific literature, as I always do, to review the studies. And boy, oh boy, I thought, well, I'm wrong on this one. I found study after study after study that showed that taking various kinds of amino acid supplements, particularly leucine, that it resulted in a positive outcome when it came to strength and muscle mass, et cetera. So, boy, I'm going to have to apologize for that one. Then I started looking more carefully at the studies, and I found that they were dominated by industry dollars. And then I started looking at review analyses done by major medical journals. And what I found is that there's no evidence that these supplements or eating protein is beneficial in terms of sarcopenia. This is fraud based upon industry's love for selling their products. You don't believe it. And if you run across information that says otherwise, trace the source. The body does not store protein. That's where you ought to start thinking about it for a minute, is if the body stored protein, considering the amount of protein consumed by the average person in the United States, Canada, Europe, even now in Asia, the excess amount of protein, they consume 6 to 8 to 10 times as much protein as they need. If that protein were stored, it'd be stored in the muscles and we'd all look like a bodybuilder. Is that what you see on the street from eating those kinds of foods? People look like bodybuilders? No, of course not. Not unless you consider fat the way you build a body. So, just logically, you'd realize that this can't be true. But the scientific data, analyzed by real scientists, not tied to industry, they tell the truth. They tell you that these things are of no benefit. And I'm here to tell you that they're of harm. Because the foods that are high protein will kill you in terms of heart disease and cancer and diabetes and all kinds of autoimmune problems. And the supplements, taking them, they'll knock out your liver and your kidneys and your bones, give you kidney stones too. So I've done the research. I'll be glad to discuss it with anybody. I'm Dr. John McDougall. Sarcopenia is not a problem solved by more protein, but a little exercise helps. Yes, it does.